Important message. In the United States, heart disease is the #1 cause of death among older adults. If you're a senior or care for someone who is, understanding the best nutrients for heart strength isn't optional. It's essential. People across the United Kingdom, Canada, and Australia are also facing a growing epidemic of cardiovascular issues among their aging populations. When people hit their 60s, 70s, or even beyond, their heart has already beaten more than 2 billion times. That's not just poetic, it's biological wear and tear. And unless we actively give our hearts what they need, we're going to face consequences that no medication can fully reverse. In the United States, seniors are often prescribed multiple medications before any real dietary intervention happens, and many times it's already too late. Why do we wait until someone has a heart attack before we talk about nutrients? Why aren't cardiologists in hospitals in Canada or the United Kingdom discussing magnesium deficiency during discharge instructions? This is not theoretical. It's happening every day. Magnesium is one of the most underappreciated nutrients for a senior's heart. If your heart skips a beat, or feels like it's fluttering, if your legs cramp at night, or you feel anxious without explanation, there's a high chance your magnesium levels are low. This mineral supports over 300 biochemical reactions in the body. And for the heart, it regulates rhythm, reduces blood pressure, and helps arteries stay relaxed. In the United States, it's estimated that at least 60% of adults over age 65 are magnesium deficient, mostly due to medication use like diuretics and poor soil quality that leads to mineral-depleted food. Magnesium glycinate or citrate are more absorbable forms for seniors. Don't expect your multivitamin to cut it. You need targeted supplementation, especially if you're on heart meds. You ever heard someone say their blood pressure meds make them feel tired all the time? Often it's not just the medication. It's the nutrient depletion the meds are causing. Now think about potassium. Most Americans over 60 are eating too much sodium and not nearly enough potassium, and it's literally breaking their hearts. In the United Kingdom and Australia, this same imbalance is leading to widespread cases of high blood pressure in retirement-age adults. Your heart muscle contracts and relaxes thanks to the movement of potassium and sodium through its cells. Low potassium? Your heartbeat becomes irregular. Potassium is especially critical if you're dealing with arrhythmias or congestive heart failure. But here's the problem. Seniors are afraid of bananas because of outdated advice around sugar and carbs. But bananas, avocados, sweet potatoes, these foods are rich in potassium, and you can't afford to skip them. In Canada, researchers found that seniors consuming over 4,000 mg of potassium daily had significantly lower blood pressure, even compared to those on medications. The United States dietary guidelines talk about sodium all the time, but they barely highlight potassium. Why is that? Then there's coenzyme Q10, CoQ10. If you're taking statins, listen carefully. Statins deplete CoQ10, and this compound is absolutely vital for your heart to produce energy. Your heart is the most energy-demanding organ in the body. Without enough CoQ10, the heart's cells literally begin to fail, leading to fatigue, shortness of breath, and in some cases, heart failure. Seniors in Canada and the United States are prescribed statins without ever being told this. CoQ10 also improves ejection fraction in heart failure patients. This means the heart can pump blood more effectively. And in Australia, cardiologists have begun to recommend CoQ10 alongside medications more routinely, showing a shift toward integrative care. But many seniors still don't even know what it is. Ubiquinol is the more absorbable form, and for seniors over 65, it can make a dramatic difference. Some seniors have reported going from unable to walk to the mailbox to walking a full mile within weeks of CoQ10 supplementation. Let's talk about omega-3 fatty acids. EPA and DHA from fish oil are not just good fats, they are structural components of your heart cells. In fact, seniors who consume higher levels of omega-3s have lower rates of sudden cardiac death. This isn't some fringe theory. It's backed by studies done in both the United States and the United Kingdom. In one American study, older adults who consumed at least 2 servings of fatty fish per week had up to a 35% lower risk of heart-related mortality. Yet, walk into any nursing home in Canada or the US, and fish is rarely served more than once a week. Omega-3s reduce triglycerides, lower blood pressure, reduce inflammation, and stabilize heart rhythm. Most importantly, they reduce the risk of clots and strokes, one of the most devastating outcomes for seniors. If your blood is too thick, your risk of clotting goes up. Omega-3s thin the blood slightly, naturally, and that can save lives. For those who can't eat fish, purified fish oil or algal oil supplements can fill the gap. You need at least 1,000 to 2,000 mg combined EPA and DHA daily for clinical benefits. Vitamin D is another major player, and not just for bones. Low levels of vitamin D are associated with increased risk of hypertension, heart failure, and even coronary artery disease. Seniors in the northern United States, in Canada, and in the United Kingdom are particularly vulnerable because they get less sunlight exposure. As skin ages, its ability to convert sunlight into vitamin D also decreases significantly. Many seniors are shut indoors for most of the day, especially during colder months, leading to severe vitamin D deficiency without anyone noticing. It affects calcium metabolism, inflammation, and even how well your heart contracts. Vitamin D receptors are found in the heart muscle itself. A level below 30 ng/ml is considered insufficient, yet many seniors are walking around with levels below 20. Vitamin D3 is the preferred form, and it should always be paired with K2, especially if you're supplementing over 2,000 IU per day. K2 ensures calcium goes into the bones, not the arteries. Then we have B vitamins, especially B6, B9, folate, and B12. These 3 nutrients help regulate homocysteine, an amino acid that becomes toxic to the cardiovascular system when elevated. High homocysteine levels are strongly linked to increased risk of heart attacks, strokes, and arterial damage, especially in seniors. In the United States, many older adults have poor absorption of B12 due to reduced stomach acid, especially those on antacids. People in Australia and Canada are also facing similar trends. Yet most doctors never test homocysteine levels in routine labs, even in heart patients. This marker can be a huge early warning sign. Supplementing with methylated forms of B12 and folate can drastically lower homocysteine and protect your heart. If you're feeling unusually tired, lightheaded, or have numbness in your feet, it could be a B12 deficiency affecting your nervous system and heart. Taurine is one of the most overlooked nutrients for heart health, especially for seniors, and yet its deficiency can have serious consequences. It's an amino acid that plays a critical role in regulating calcium within heart cells, supporting heart rhythm, reducing blood pressure, and preventing dangerous oxidative stress. In Japan, where taurine intake is much higher due to seafood-rich diets, the rates of heart failure in seniors are dramatically lower than in the United States, United Kingdom, Canada, and Australia. This is not just correlation. It's biological cause and effect. Taurine also helps improve cardiac output in patients with congestive heart failure, meaning the heart pumps more blood with each beat. Seniors who complain of being out of breath, just walking across the room might be dealing with a taurine deficiency, especially if they avoid animal proteins or have digestive issues that impair absorption. Supplements of 1,000 to 3,000 mg daily are often used in clinical trials, and the benefits include improved blood pressure, better heart rhythm, and reduced inflammation. L-carnitine is another nutrient that should be discussed in every cardiology appointment for older adults. It transports fatty acids into mitochondria, the energy factories of your cells, so your heart can use fat as fuel. This is essential because the heart relies heavily on fat for its energy, not sugar. Studies in the United States and Canada have shown that seniors with low L-carnitine levels often suffer from angina, reduced exercise tolerance, and heart failure symptoms. When supplemented, L-carnitine has been shown to reduce hospital admissions in patients with chronic heart disease and even improve survival rates. Acetyl L-carnitine is better for seniors because it also crosses the blood-brain barrier, supporting both heart and brain function. Fatigue, muscle weakness, and feeling like you just can't do what you used to could be tied to L-carnitine deficiency. Seniors in long-term care facilities often get low-protein diets, meaning they're not making enough of this critical nutrient. Vitamin K2 deserves far more attention than it gets, especially when talking about heart health in the elderly. K2 directs calcium away from the arteries and into the bones, preventing a condition called arterial calcification, which stiffens the blood vessels and increases the risk of heart attacks and strokes. This is especially dangerous in seniors who are taking calcium supplements without balancing it with K2. In the United States, thousands of older adults are being told to take calcium for osteoporosis without any discussion of K2, which can lead to more harm than good. In both Australia and Canada, newer clinical guidelines are beginning to recognize this issue, but public awareness is still very low. Vitamin K2, particularly the MK7 form, has been shown in studies to reduce arterial stiffness and improve blood vessel elasticity. Seniors who have been diagnosed with atherosclerosis or coronary artery disease should absolutely have their K2 status evaluated. It can make the difference between stable plaque and a fatal clot. Polyphenols are compounds found in plant foods that have powerful antioxidant and anti-inflammatory properties, and their role in heart health cannot be overstated. These compounds, found in foods like berries, dark chocolate, olives, and green tea, help improve endothelial function, the ability of blood vessels to dilate and maintain healthy circulation. Poor endothelial function is one of the first steps toward heart disease. In the United States and United Kingdom, where ultra-processed foods dominate the diets of many seniors, polyphenol intake is dangerously low. This creates a chronic inflammatory state in the arteries, increasing the risk of heart attacks, strokes, and high blood pressure. In contrast, seniors in Mediterranean regions who consume high levels of olive oil, grapes, and herbs have significantly lower rates of cardiovascular death. Polyphenols also reduce LDL oxidation, which is a key step in the development of clogged arteries. You don't need exotic supplements. Just eat more polyphenol-rich whole foods, and, if needed, look into concentrated extracts like resveratrol or olive leaf. Another critical nutrient is nitric oxide precursors, like L-arginine and L-citrulline. Nitric oxide is a molecule that helps blood vessels relax and expand, improving circulation and lowering blood pressure. As we age, our natural nitric oxide production decreases significantly, leading to stiffer arteries and increased cardiovascular strain. In the United States, millions of seniors are living with high blood pressure, and yet they've never heard of nitric oxide or how diet affects it. Beetroot juice, watermelon, arugula, and spinach are excellent natural boosters of nitric oxide. Supplementing with L-citrulline is more effective than L-arginine in older adults, as it has a longer half-life in the bloodstream. Seniors with peripheral artery disease who struggle with walking due to poor blood flow in the legs have seen real improvements in mobility and endurance with nitric oxide boosters. Antioxidants like vitamin C and vitamin E also play a role, but it's critical to understand that they work best in synergy. Vitamin C helps regenerate vitamin E and supports collagen production in blood vessels, keeping arteries strong and elastic. In the United States, many older adults are taking synthetic alpha-tocopherol, a form of vitamin E, in isolation, which may do more harm than good. Real benefits come from a full-spectrum vitamin E complex, especially tocotrienols, which have been shown to reduce plaque buildup in arteries and protect the heart from oxidative damage. Seniors dealing with chronic inflammation, often linked to diabetes, obesity, or autoimmune conditions, benefit immensely from a targeted antioxidant strategy, but it has to be balanced, not overdone. Selenium is another trace mineral that supports heart health by boosting glutathione, the body's master antioxidant. Deficiency is common in certain regions of the United States and Canada where the soil is depleted, and older adults who rely heavily on processed foods or institutional meals may not get enough. Low selenium levels have been associated with increased risk of cardiomyopathy, a condition where the heart becomes enlarged and weakened. Brazil nuts are one of the richest natural sources of selenium. Just one nut per day can meet your needs, but supplements are also available for those who need higher doses for therapeutic benefit. Zinc is also crucial, and not just for immune function. It plays a direct role in regulating inflammation and supporting the integrity of blood vessels. Seniors with low zinc levels are more likely to experience poor wound healing, increased oxidative stress, and arterial stiffness. In the United Kingdom and Australia, studies have shown that zinc deficiency correlates strongly with heart failure risk. Zinc also supports insulin sensitivity, which is critical for seniors with type 2 diabetes, a known risk factor for heart disease. Zinc picolinate or citrate forms are typically best absorbed, and daily intake should be monitored, especially in those with digestive issues or on diuretic medications. Choline is another silent factor. Most seniors do not get enough choline, yet it is essential for the production of acetylcholine, a neurotransmitter that supports both heart rate and brain function. Egg yolks, liver, and soybeans are rich sources, but fear-based cholesterol. Advice from decades ago caused many older adults to avoid these foods. This has led to widespread choline deficiencies across the United States and Canada, especially in women over 60. Choline also supports methylation, which helps control homocysteine levels, further protecting cardiovascular health. This isn't just about individual nutrients. It's about creating a comprehensive strategy where every part of the diet and supplement routine works together. Seniors don't just need a little more omega-3 or some vitamin D. They need a total nutritional rework that accounts for age-related changes in absorption, medication interactions, and long-term inflammatory damage. These are not abstract ideas. These are biological needs that can determine whether a person enjoys their retirement or spends it in and out of hospitals. One of the biggest mistakes happening right now in the United States, Canada, Australia, and the United Kingdom is that seniors are showing obvious signs of nutritional heart decline. But these signs are being written off as just part of getting older. That's a lie. When someone feels exhausted by noon, when walking up a few stairs leaves them winded, when there's persistent swelling in the ankles, or they feel lightheaded when standing, these are not just aging. These are red flags. These symptoms can signal nutrient depletion, poor circulation, or early heart failure, and too many people are misdiagnosed, over-medicated, and sent home with no nutritional guidance. In the US, a senior might leave the hospital after a cardiac event with 4 new prescriptions, but 0 conversations about taurine, CoQ10, or omega-3s. This isn't modern healthcare, it's reactive symptom management, And yet, the science is already here. We have overwhelming research proving that targeted nutrients like magnesium, potassium, vitamin K2, and L-carnitine can transform heart function, especially in people over 60. But the system is not built to educate patients, especially not seniors. A 73-year-old woman in Arizona should not have to scroll through message boards to figure out why her legs are cramping every night or why her heartbeat feels irregular. A retired man in Alberta shouldn't have to hear from a neighbor, not a doctor, that CoQ10 might help with the statin-induced fatigue that's been ruining his mornings. People are not just dealing with illness. They're dealing with a complete failure of the system to support healing from the inside out. Let's talk about timing and absorption, because it's not just what you take, it's when and how you take it. Seniors often have reduced stomach acid, which means nutrients like B12, iron, and zinc may not be absorbed well from food or cheap supplements. Sublingual or methylated forms of B12 bypass the gut and are much more effective for older adults. Minerals like magnesium and calcium should never be taken together because they compete for absorption. Vitamin D is fat-soluble, and if taken on an empty stomach, it won't do much for your heart or bones. And supplements like L-carnitine and CoQ10 are better taken earlier in the day with a meal that contains fat to enhance absorption and avoid insomnia. Seniors deserve to know these details. Their recovery depends on it. Some seniors might say, "But I eat healthy." What does that mean in practice? Because for many people, healthy still includes too much sodium from canned foods, not enough potassium-rich vegetables, low protein intake, and hardly any healthy fats. A real heart-strengthening diet includes wild-caught fish 2 to 3 times a week, liberal use of extra virgin olive oil, dark leafy greens daily, avocados, berries, and nuts. It includes fermented foods to improve gut health and nutrient absorption. It reduces inflammatory oils like soybean or corn oil that are still in almost every packaged food sold in the United States. It means cutting refined sugars, which promote inflammation and damage arteries over time. Seniors with diabetes are particularly vulnerable because the combination of high blood sugar and nutrient depletion is a recipe for silent heart disease. Real-life stories reflect this every single day. A man in his early 70s from Florida was hospitalized 3 times in 1 year for heart failure symptoms: swelling, breathlessness, fatigue. He was on 5 medications. After working with a nutritionist who focused on magnesium, taurine, CoQ10, potassium from whole foods, and a strict elimination of processed foods, he didn't just stabilize, he started biking again. Not every case. Is that dramatic? But these outcomes are not rare when nutrients are prioritized. And yet you rarely hear about them because they don't come from billion-dollar drug trials. They come from food, supplements, and strategy. A widow in British Columbia with chronic hypertension was able to cut her blood pressure medication in half after 6 months of improving her omega-3 and vitamin D intake. These stories don't make headlines, but they are real and happening quietly in the lives of those who take control. If you or someone you care about is in their senior years, and there's been a decline in energy, endurance, mood, or circulation, it is essential to ask, have the right nutrients been tested? Has homocysteine ever been measured? What's the magnesium level, the CoQ10 status, the vitamin D number? Because these are not exotic metrics. They are basic tools for heart health, and yet they're rarely used unless the patient demands them. In the United States, this means advocating for your own labs. In the United Kingdom and Canada, where national health care can sometimes limit access to specialized tests, it may require private labs or insisting on a second opinion. It is not overreacting. It's survival. There is also an emotional toll that comes from being told that fatigue, dizziness, and declining strength are just normal aging. That message breaks people down. It robs them of hope, of initiative. The truth is that most seniors are not too old to heal. They are often undernourished, overmedicated, and emotionally worn down from years of dismissive care. When someone finally experiences what it feels like to have energy return, to climb stairs without gasping, to walk without the cane, to wake up rested, it is life-changing. And that transformation almost never comes from another pill. It comes from restoring what the body has been missing for years, sometimes decades. Even mild dehydration, common in older adults, can raise heart rate, thicken blood, and increase risk of clotting. Drinking more water sounds too simple to matter, but for many seniors, it makes a huge difference, especially when paired with electrolytes that include sodium, potassium, magnesium, not just sugar-laden sports drinks. This basic shift in hydration supports blood volume and keeps blood pressure stable. Seniors on diuretics lose water and minerals daily and are often not told to replace them, leading to fatigue, confusion, and heart irregularities that are preventable. Sleep and stress also play a powerful role in senior heart health. Poor sleep increases cortisol and inflammation, putting additional stress on the heart. Seniors who don't sleep deeply often have elevated nighttime blood pressure, a risk factor for stroke that's rarely measured. Supporting sleep through magnesium, glycine, tart cherry, or melatonin can protect the heart. Emotional stress, from grief, isolation, or fear of health, decline worsens blood pressure and damages the endothelium, the lining of the arteries. Connection, support, and purpose are not just emotional needs. They are physiological safeguards. What the heart needs at 70 is not what it needed at 40. The senior heart needs nutrients in concentrated, bioavailable forms. It needs circulation-enhancing foods, antioxidant support, blood pressure balance, mitochondrial energy support, and above all, consistency. Missing a few days of omega-3s or magnesium might not be a big deal at 30. At 75, it could be. This isn't about perfection, it's about precision. Aging with strength and grace is possible, but it requires effort, knowledge, and a health care approach that doesn't treat the body like a machine, but like a living, adapting organism. None of this is hypothetical. These nutrients are available. The science is available. What's often missing is the guidance. Seniors across the United States, the United Kingdom, Canada, and Australia deserve better. They deserve to feel strong again. They deserve to understand their own bodies. They deserve to know that heart failure isn't always inevitable, and that many of the symptoms they've been taught to live with are not part of growing old. They're signs that their heart needs help, and that help is closer than they think.